So just very broadly, there's a few levels to the spine. We call the cervical spine, which is known basically as all the neck bones, the thoracic spine, which is the spine around the rib cage, the lumbar spine, which is the lower back, and the sacrum, which is the tailbone. The most common areas that people have pain is within the cervical or lumbar spine because these are the areas that have motion. And with motion comes arthritis and instability and areas where we can have pain generators. We also have three curves in our spine. We have our cervical spine, we have our thoracic spine, which is here, and our lumbar spine is here. And if you look, these all work to balance themselves. The cervical and the lumbar curvature match each other, and they basically will balance this thoracic curvature. So when someone speaks about neck pain, they also often speak about pain that's radiating either up over their head or over their shoulders and down their arms. They can discuss it as a deep pain, an electric pain, or electric shock-like symptoms, a stabbing pain. People can wake up with numbness or have numbness throughout the day, and they can have weakness as well. People will come sometimes in with problems with balance. And all of this can come from the neck and can be associated with neck pain in association with radicular symptoms. Anytime that we speak about radiculopathy, we speak about irritation of the nerve root. So radiculopathy is simply the way that we describe inflammation within the nerve roots that come off of the spinal cord. And you can have radiculopathy coming from the neck, and you can have radiculopathy coming from the lower lumbar spine. All nerves go to very typical patterns within the skin. So we call these innervations called dermatomes. And this is a dermatome map. So just like you talk about longitude and latitude in a globe, this is a dermatomal map. And what we can do is we can have a better understanding of where is the disease before we even look at an X-ray or MRI, simply by listening to our patients and understanding, if someone has numbness or tingling going to the thumb, radiating over the forearm here, they may have a problem at the C5 or the C6 level. And we try to correlate the area where people are having pain with what we see on X-ray and MRI, and that allows us to be able to treat our patients better, more effectively, and have better outcomes. In addition to a dermatomal map, which talks about where sensation goes, there's also myotomal distributions. So for instance, the C6 nerve root controls the biceps brachii, which allows us to flex our elbows. And if someone has weakness in terms of flexing their elbow and they're talking about having pain radiating down over their forearm and down at their thumb, these all correlate together to once again have us look at the C5, C6 level. I talk about the C5 and C6 level very specifically because it's the most common level that someone will develop radicular symptoms, degenerative disc disease, and problems in the neck. Myelopathy is a different sort of pain and disease. This refers more to a problem with balance that occurs from a problem in the neck. Now, when we talked about radiculopathy, that was compression in the nerve roots, which are little rootlets that travel off of the spinal cord. And at each level of the neck and thoracic spine and lumbar spine, there's branches of nerve roots that travel out. They go to the arms, they go around the ribs, and they also travel out towards the legs. Myelopathy speaks about actual compression within the spinal cord. And if you look here at this MRI picture right here, you can see that there is a big, large herniated disc here. And you can see that there is compression on this black cord coming down, and this is your spinal cord, or a person's spinal cord. You can see that the compression here is causing a nerve root injury and is causing an increased fluid signal and white signal here, which is a sign of a spinal cord injury and damage. The compression that is seen here can be much more dangerous than an actual nerve root problem. Spinal cord injury is much more serious. It does not resolve or heal well and can be permanent. I often can see patients come in that are described that they've been walking independently, and all of a sudden felt like they were walking drunk and had to go to walking to a cane, and then had to move on to walking with a walker. And they feel that their legs are heavy. They feel that they have to have a broad-based gait. We look in their cervical spine or in their thoracic spine, and we can see this kind of picture of a disc herniation or some sort of arthritis compressing on the spinal cord, whether it's in the cervical or in the thoracic spine. And it can be something that needs to be treated in a more urgent fashion. And in some points, if it is an acute injury that happened very quickly, it needs to be treated in an emergent fashion. So patients will also come in talking about hand and arm numbness, clumsiness. They say that there's a change in their handwriting, or they have difficulty buttoning their shirt. They may be dropping objects when they're not paying attention to them. And in very rare cases, they will talk about bowel and bladder dysfunction.